Mary Neubauer, other co-chair. I am the representative on the Milwaukee Mental Health Task Force. And I am now the, what is my title now? It's the vice chair, thank you, of the Milwaukee Mental Health Task, of the Milwaukee Mental Health Board. Thank you.
Congratulations, Mary. Okay, we'll kick off the meeting. The meeting materials are posted on the website, and at some point that email address will go in, or that website will go in the chat. Thank you, Barbara. I'm going to review the ground rules real quickly. Thank you for joining us. Please follow these ground rules for our virtual meeting. Everyone will be muted throughout the session. We hope to have time after each speaker for a few questions. Use the chat feature to type your questions. We will answer as many as we can. Sign language interpreters are provided at this meeting. If you need assistance accessing the interpreter, put your request in the chat. Speakers, please say your name before you speak to help with accessibility. Auto captioning is provided. You may turn captioning on or off. Click on the caret symbol next to the closed captioning live transcript button if you want to hide subtitles or to view the full transcript. If you need help with that, also put that in the chat. At the top of your video screen, you can choose between speaker view or gallery view, whichever you prefer. And a big thank you to everyone who joined us for the first of 2 forums in our series, A Look Inside Mental Illness and the Criminal Justice System, provided in partnership with Milwaukee Turners. Stay tuned for the next forum in the series in April. We are working with Emilio de Torre to form up the plans.
April 5th is Election Day, and a historic election for the city of Milwaukee, where a new mayor will be elected. We are pleased to welcome Mayor Johnson at this time, and Mr. Donovan will join us later in this meeting. We provided each candidate with some specific questions in advance, which are posted with our meeting materials. The link is in the chat. The general ask was to offer your vision for issues that are a priority for people who live with mental illness or substance use disorder. Welcome, Mayor Johnson.
Sorry, we're a little bit ahead of schedule. Mayor is scheduled to join us at 3:10. So I think we're ahead of ourselves. So why don't I share the links to the materials in the meantime as we wait for the mayor to join us. So people can review those materials. So everyone, this is Barbara Beckert from Disability Rights Wisconsin, and I help to coordinate the task force. I've just put in the chat a link to our meeting materials. So we hope that will be handy for all of you to be able to review those. And in addition, we do have a specific link to the materials that were shared with the mayoral candidates. So let's just see if Mayor Johnson has joined us yet. Yes, it looks like, Mary, if you want to say the welcome again, it looks like Mayor Johnson is with us now.
Okay, I'd like to welcome Mayor Johnson for his input on the forum. There he is. Welcome.
Oh, good afternoon, everybody.
Good afternoon.
Good afternoon.
Good afternoon.
Well, we're so pleased to have you here, Mayor Johnson. We know we provided you with some questions and background information in advance. The Mental Health Task Force is happy that you're here to share your vision for mental health services in our community and to respond to the questions that we had shared with you. So the floor is yours.
Awesome. Well, first of all, I again want to say good afternoon to everybody and thank you all for having me here this afternoon. Then second of all, to thank everybody for all the work that they do on this very important issue this very important topic here in our community. I've talked at length about public safety in Milwaukee, and I have many times said time and again that public safety is multi-pronged. That it cannot just be police. And as a matter of fact, if you ask police officers, they'll tell you that they can't do it alone. But I think that when you dig down further into public safety, it's not just police, it's also earlier interventions, it's mentoring, it's root cause things like family support and jobs, but it's also making sure that there's access to mental health services for the people who live here in our city as well. Something that I often say. And if we drill down even deeper into that subset and talk about mental health, that isn't a silver bullet approach either. There are many things I think that need to be considered there as well. A number of things that I am proud to have worked on over the years as a member of the city council. For instance, since I've been a member of the city council and certainly supportive of these things as mayor as well, is making sure that we have a system of trauma-informed care here in our city, so that young people who experience, quite frankly, some of the things that I experienced growing up living in Milwaukee, have access to be able to process their emotions and thoughts and mental state after having those experiences growing up. I'm fortunate enough to have worked with a number of members who have been of a like mind in terms of making sure that the city provided funding to expand on our crisis assessment response team, our CART teams that have been available in the city of Milwaukee with the Milwaukee Police Department, as well as in Milwaukee County too, so that interactions that individuals have in our city don't just revolve around somebody who's got a badge and a gun, but also revolve around, if you need it, somebody who can actually help you if you're having a mental health crisis. Because again, the police cannot do it alone. It's important that people receive access to care and access to services where they are, including when 911 is dialed. So I think that's something that's very, very important. I think that as it relates to mental health, like many other things in our community, housing is certainly an issue that is tantamount. It's critical, it's important. And if you have a base there, then there are so many other services that you can wrap around in order to help to solve it. I feel like I've got a pretty good record on housing and housing availability in Milwaukee, and I'm hopeful that we'll be able to continue to build off those. When you look at the initial tranche of federal funding that the city of Milwaukee received, $197.1 million, $43 million went into affordable housing. And we put in, another $10 million into our housing trust fund. And my challenge to developers there was to help us to address the shortfall of housing units that we have in the city that could help everybody, including people who have mental health issues. And so we're looking to make an impact on the roughly 32,000 units in Milwaukee, that affordable housing units rather, that we're short on here in the city of Milwaukee. I've also been a supporter of and have been there a number of times already as mayor, as a matter of fact, to the Milwaukee Housing Resource Center, making sure that there's access between residents, tenants, as well as our landlords, so that those individuals remain housed. Again, because it's so important to make sure that that as a base, people have access to affordable housing, and they're not displaced from that. That wasn't all, though. We also worked to make sure that there were monies put into the launch of a right to counsel program here in Milwaukee. And so the city of Milwaukee made an investment there, and so did Milwaukee County. And we're seeing other communities across the country do something similar as well. So that, I think, is critically important. I'm glad that we were able to do that. On the issue of opioids in our community. I know that in this community we've seen a number of opioid deaths in recent years, and that's very unfortunate and something that none of us certainly want to see. The city of Milwaukee, along with other jurisdictions in Wisconsin, will be receiving, and I don't know the exact number when these monies will come down, but I know that post the opioid settlement, the city of Milwaukee will come into some financial resources, I think, that will help to address some of the issues that we have around making sure that Narcan and other things are available to people that may have issues around that issue in our city. So a number of areas, and certainly there's space for us to be able to continue to work together on these issues moving forward. And I'm looking forward to being able to work with groups like this in order to make sure we're tackling those very important issues right here in our community.
Thank you. Okay, we've got, I'm going to take questions in the chat.
And I'd be happy, this is Barbara Beckert from Disability Rights Wisconsin. I'd also be happy to read some of the specific questions that we'd like to hear you address Mayor Johnson. Would that be helpful?
Sure.
Sounds good. All right, so I know you talked a little bit about responding to the crisis in terms of deaths from substance use in our community. So we're wondering what your plan is to address the record drug overdose deaths, and do you have any strategies that could improve access to Narcan to make it more widely available?
Yeah, as I was saying, that and I don't know the exact details on when those monies will come down, but I know the city should be a beneficiary of opioid settlement monies. And then when those monies come down, there'll be an opportunity for us to be able to address this issue, I think, including making sure that something like Narcan is available, or more widely available, that is, here in our community. I don't know how closely this group may have worked in the past with the city county task force on opioids and cocaine. There was a list of recommendations from that group that may be able to be funded when those dollars were to come down as well. So I unfortunately don't know exactly the timeline on when those monies will come down, but I think certainly one of the points that we'll be able to research and address is the availability of Narcan and making sure that it's more widely available in the community.
Okay, thank you, Mayor. We also had a specific question about youth mental health that we're hoping to hear from you on. So as you may know, there are a lot of challenges right now in our community for our youth. A lot of youth are struggling and having difficulty accessing mental health services. So there can be long wait times, lack of access without kids getting involved in the child welfare or juvenile justice system, or services only available after youth have really declined to the point of a severe emotional disturbance. So we wondered about what your plan is to address the clinical and emotional needs for youth in our community on more the front end to facilitate prevention, early intervention, and treatment access, so not as many young people are in such a grave situation.
Yeah, I'm happy that you said front end, because I think that's critically important here, is the trauma that young people face in their lives. And I just mention that here, and I'm sure folks have had the opportunity to hear me talk about my own experience growing up in Milwaukee as well, and the trauma that I faced growing up, and the trauma that kids in this city are facing right now. As a matter of fact, I had the opportunity to walk with the Office of Violence Prevention in one of my old neighborhoods, and I moved around a lot when I was a kid, and be at the house, one of the houses where I lived, and right across the street, just a few weeks ago, 6 people were murdered. So while I'm not there in that neighborhood now, there still are kids who are there. And that's not something on any block that any kid in our city should have to deal with. So it'd be my desire to work to reduce levels of trauma before they even start. And again, just going back to my own experience growing up here and the conversations that I've had with elders in this community over the years. In Milwaukee, unfortunately, for the past number of years, we've topped the worst lists, especially for people of color, especially for African Americans. And I would like to put us in a position where we're not on those lists. Years ago in this city, we used to have the highest quality of life for African Americans in the United States, and I think we need to get back. We need to get back to that. But when you talk about front end root cause preventative measures to reduce the likelihood that young people will interact or engage with episodes of trauma in the first place, it requires for us to make sure that people have access to family supporting work so that there is stability in the lives of parents. And that stability in the lives of parents translates into stability into the lives of their children and positive interactions that their children have at home and in society overall. So that's something that I seriously want to get to work at addressing here in Milwaukee. But in terms of again, there's trauma informed care, and I've been supportive of that since the city of Milwaukee has engaged in that. I know that our partners over at Milwaukee County are working to bring those services closer to home, in the city of Milwaukee and not far out in Wauwatosa that is inaccessible for the vast majority of people who need those services. And so I'm supportive of those efforts. I cheer those efforts. I applaud those efforts, as a matter of fact. And I'm happy that the county is taking that stance with bringing those services closer to the people who live here in the city of Milwaukee. So again, a number of areas for me, I think, preventing trauma in the very first place by making sure that there's stability in the home and in the neighborhood reduces the likelihood that young people will interact with trauma in the house or outside the house. And that's something that I want to work on. And then being supportive of initiatives like we're seeing from our partners at Milwaukee County, making sure that services are available closer to home for people who need them. And then our own initiatives that we have with our police department, especially police department districts that are in neighborhoods where there's a lot of crime, a lot of violence, like police district number 7, to have trauma-informed care available for our youngest citizens when they experience those things, I think are all important, and we want to see them continue.
Thank you so much. I think Christine Apple, one of our co-chairs, has a question for you.
Thank you so much, Mayor, for talking to our group. A lot of times we have an issue where someone's experiencing a mental health crisis, and unfortunately they end up in one of our jails. What's your position on, that first contact with police, how we can divert people from the criminal justice system and more into the health system? Thank you.
Mm-hmm. Yeah, no, I think that's important, and you're absolutely right. That's not the place where those folks who are experiencing mental health episodes ought to be. That's not where they're getting the help that they need, and so that needs to change. It also ties up valuable police services and resources. So then, those officers, especially those ones that are the actual sworn officers, are tied up and not able to go to people out there who actually need them. And so that's why, again, I have been a supporter of and a champion of and an expander of the CART program, so that when individuals, when calls are made and there is police contact, that, hopefully we're able to bring folks on. There are clinicians that help to divert people away from a jail cell and into services. And again, now that our partners at the county are here with a new facility that'll be coming online soon, hopefully we'll be able to do more of that to get more people out of that pipeline, in the jail cell and into actual services that they actually need closer to home, where they live. That, I think, is the appropriate way to address the issue. Simply locking folks up or incarceration for individuals that have a number of issues, especially mental health issues, is not going to help us to solve them. Right? We need to make sure that folks have housing. We need to make sure that folks have preventative measures. Make sure that folks have the resource in order to overcome the challenges that they have. And that's why I've been a champion of our CART program, and I want to work to make sure that there are other avenues available as well if we're able to make them happen.
Thank you. A follow-up question from the chat. I think the first question that was asked. I know that you've been a supporter of CART teams and some have been approved. Can you say when that the new ones will happen?
I think the only holdup right now is working to make sure that we get clinicians who are able to work on those shifts. Those are very challenging. They're very challenging positions to fill. The resources are there. We put forward a budget amendment before in order to make sure that those resources were there. I led on that. But we have to have the professional expertise in order to execute the program. And so the police are there and they're ready to do their part. And they have officers, my understanding, that are assigned and ready to get to work on that. But we need clinicians in order to take that up. But it's during some of the most challenging times of the day, even for folks in law enforcement. So I guess I say that to say that it can be a challenging and scary job. And so that's kind of the holdup here, is that we need folks to take up the mantle and do that work, especially because as all of us understand, the best way to make sure that folks get the services that they need is this sort of diversion, and not to have them in a jail cell.
Thank you.
Mm-hmm.
Got about 4 minutes left. Do we have additional questions in the chat?
This is Barbara Beckert. I'll raise another question. I wonder if you can talk a little bit about what opportunities your administration will provide to ensure that the voices of people who are experiencing mental health needs and people with other disabilities help to guide policy for the city of Milwaukee.
Yeah, and that's a great question. And I guess if memory serves me correctly, and I've only, I think we've only done this one go round ever in my tenure as a member of the Common Council. And I certainly haven't made these appointments, at least not yet, as mayor. I hope that post April 5th, I'll have the opportunity to continue on as mayor and make these sort of appointments in the future. But we've got a board of health in Milwaukee that helps to guide our health department. So that, I think, is an opportunity. And then on some of these other issues or other areas of oversight, rather, where I know that the mayor does have influence and indeed makes the appointments, right, is the Fire and Police Commission, right? And so if the police department, working along with our partners, is going to implement programs like a CART team or a crisis, or a trauma informed program for young people. We want to make sure that the people that we appoint to the Fire and Police Commission are competent, are caring, and are compassionate. And that'll help to provide that oversight that we need to make sure that the people that we care about on this forum get the services that they need, both on the health department side in governing that department, which is very important. Also in service delivery on the law enforcement end as well.
Mayor Johnson, I have a question. In 2016, Mayor Barrett, the training for the Milwaukee Police Department for CIT became a force-wide mandated training. And I was in conversation today with individual that's now at the training academy and is in charge of gathering information about putting together an advanced crisis intervention team training and some other specific training, and has no relationship with the previous coordinator. And the mental health task force has been involved in the past with providing direction toward training. If you are elected as the mayor, would you be willing to work with the mental health task force as to taking in ideas and direction for further training for the Milwaukee Police Department as to training ideas and suggestions for the future?
Yeah, I mean, that's something certainly that we can take under consideration. I mean, and I don't want to overpromise,
I
something
understand.
here because I mean, I recognize and I appreciate the fact that the Fire and Police Commission has a role to play here. And I understand I make those appointments to the Fire and Police Commission. That's why, I mentioned that it's important to have folks on that board that does the direct oversight of the fire department and police department to be caring, compassionate, and competent in their approach. So I think that there certainly can be a line of communication open on that. And I think that, especially with the commissioners that we have now, they certainly would have interest in making sure that the best possible training is available to our police officers. So I think there certainly can be future conversation and a line of communication open on that front. Absolutely.
Thank you very much.
Yeah, absolutely.
Mayor, I want to just kind of collate some of the things that are in the chat. It seems that someone from Children's Hospital wrote in saying that they're going to have a 24/7 emergency service for youth. There's a lot of concern about youth mental health in the city of Milwaukee, and I applaud your efforts for going upstream and having services, early intervention in MPS and other places when kids are young, so that things can be handled without a school to prison pipeline that I see. Bless you. And the other thing I'm seeing people saying in the chat is, how can we help you? How can the membership of the Mental Health Task Force be of service to you, so that when you begin these initiatives, you can count on us? So just know that we're all here to help. And I also saw Rose Steets mention in the chat that, we're here if you have any committees that we're here to also represent, so that the voices can be heard before decisions are made or policies are signed.
Yeah, absolutely. And I appreciate that. And if there are particular committees, if there are particular committees or boards that there are, that folks have interest in, I would recommend that that you send over your resumes and get that information over to the mayor's office with a particular board or commission that you would have some interest in, so that we can have them, so that we're not starting from scratch or looking to search for people, so that we have the information handy, so that when the opportunity does come up to make those appointments, we're already a step ahead of the game here.
Thank you, Mayor. And it is working. I'm serving on the Community Intervention Task Force already, representing the Mental Health Task Force.
Okay. Awesome. Well, I thank you all very much. I do have another commitment here, but I really appreciate having the opportunity to come on and chat with you guys and answer your questions. And I'm sure we'll be able to have greater conversation and a great relationship moving forward here.
Thank you very much. Have a great afternoon.
Thanks all. Bye now.
Okay, moving right along, we're gonna move, the Milwaukee Mental Health Task Force has been a long supporter of peer-delivered services, and we are fortunate today to welcome Brittyn and Calyx, and I hope I'm saying your name right. Access to Independence Peer Specialist Program Manager, who will provide an update on what is happening with peer support in Wisconsin. Brittyn, I saw you here earlier, so I'm hoping you're still there.
Hello. Hello, yes, Brittyn here. So yeah, my name is Brittyn Calyx. My pronouns are she, her, hers, or ze, them, zir. Either pronoun set is welcome. Just for a visual description too, I am a 30-something white trans femme non-binary person. I have blue and black cat's eye glasses, shorter brown hair, and I'm wearing a black blazer over a tan dress today. I'm in my room with just kind of a blank wall behind me, immediately behind my head, kind of hidden as a painting. But yeah. So yeah, I'm the Peer Specialist Program Manager at Access to Independence. I work on the Wisconsin Peer Specialist Employment Initiative. So yeah, I was invited today to kind of share out the similar share out that I offered at the Certified Peer Specialist Advisory Committee. So I wasn't sure if you all wanted me to screen share that or just refer people to the resources that were sent out earlier.
I think whatever your preference is, I can put the link to this is Barbara. I can
Okay.
put the link to the document in the chat if you'd like me to, so people can refer to it themselves, or if you want to share your screen, I made you a co-host, so either way
Okay.
is good.
Let's go with the link in the chat for now. So yeah, just first, if you end up looking at this, you'll see this is the share out that we gave at the February Certified Peer Specialist Advisory Committee meeting. Of course, some things will be updated or changed since then, but just wanted to give a brief
Excuse me,
overview.
Brittyn, could you just
Yep.
mention what that group is? Because people don't necessarily know what that group is.
Of course, yeah. So the
Thank you.
Certified Peer Specialist Advisory Committee is a committee that advises Department of Health Services, the I think it's BPTR. I forget exactly what that stands for, Bureau of Prevention and Treatment Recovery Services or something like that. And then also the Division of Care and Treatment Services under that. And so yeah, it advises DHS, Department of Health Services, on just all things peer specialists and parent peer specialists, and also specifically relating to the Wisconsin Peer Specialist Employment Initiative. And so that committee is composed of various stakeholders, including those with lived experience and people in peer specialist and parent peer specialist roles across the state, as well as other providers and such. So this was just part of that update. So with this, this was a bit of an update of some Q1 activities into Q2. Our contract year for the Wisconsin Peer Specialist Employment Initiative starts on October 1st and then runs through September 30th of a given year. So we're at the tail end of Q2 right now. So the first update there was just in regards to an increase in the number of staff at Access to Independence working on the Wisconsin Peer Specialist Employment Initiative. I shorthand that to WIPSE, so I will refer to that as the WIPSE from here on out. And so just a little bit about the people listed here, both myself in the Peer Specialist Program Manager role, Galki Vang in the Peer Specialist Community Engagement Coordinator role, and Marguerite Galindo in the Peer Specialist Workforce Development Coordinator role. So with that, In my role, I coordinate larger projects and contracts. I facilitate initiative direction and relationship building with different collaborative partners and consultants. And then also I train staff at Access and oversee quality assurance and fidelity related to our work plan, as well as budgetary considerations. Gelke Vang, in her community engagement coordinator position, takes on communications and outreach projects, as well as more direct outreach and development of a community ambassadors group. And we're working alongside EDO LLC. EDO stands for Each One Teach One. It's founded by Tara Wilhelmi, who's a certified peer specialist and parent peer specialist, as well as a CPS trainer. And yeah, Gelke also is a CPS trainer as well, and was the former assistant director at Iris Place Peer Run Respite. So Gelke is new. She started at the end of January. And then also Marguerite started at the beginning of January this year. Marguerite is in a new role that was developed this contract year, the Workforce Development Coordinator position. So that role, in that role, Marguerite will develop a more robust employer technical assistance program, also with TA or technical assistance consultants. We'll develop some supervisory supports, expanding those, as well as supporting professional development opportunities for the existing workforce, and offers direct support for privately funded trainings. And Marguerite actually is based in the Milwaukee area, has previously worked in supervisory roles relating to peer specialists and such. So we have our contact information there. So the three of us are at different places across the state. And so let's see here too. I'm not seeing the chat. And so if you are asking questions in the chat, I just want to check that. Okay, cool. And so I'll go on here. So yeah, so as of today, there are currently 1,144 certified peer specialists and 44 parent peer specialists across the state. That number 44 for parent peer specialists is before the finalization of the February 23rd CPPS exam and that results. So based on our raw data, we have 11 more certified parent peer specialists who passed that exam. However, we are also doing some data analysis of that exam just to finalize the results, but we're likely to see that increase to 55 very soon. So with trainings, I won't read all of this word for word, but what I will say is the vast majority of our parent peer specialists, the vast majority of our peer specialist trainings are privately funded trainings. That has not always been the case. The state has also funded a number of trainings throughout the initiative's history. But these trainings are the preparatory training where hopeful certified peer specialists take the 48-hour course and then go on to take the state exam. And they need to pass that exam with an 85% or higher to become a certified peer specialist. The same process is in place for certified parent peer specialists. But over time, most of our trainings are now privately funded, meaning that they are not funded through the WIPSI contract that we hold. And so entities that might fund or sponsor a training include different counties, nonprofit organizations, tribes, institutions such as the Department of Corrections or Mendota Mental Health Institute or other places like that, as well as other community resource organizations. So we've already had a number of privately funded trainings this year. We also have state-funded trainings that are funded through our contract that are being scheduled actively this month. our first state-funded certified peer specialist training is scheduled to begin in May. So with that, you can refer to these to see more about who's sponsoring trainings and what those are looking like. But we have already covered every county in the state in terms of available trainings this contract year, and in many cases, more than once for a given area. We have also held a statewide certified parent peer specialist training this year as of January. So we have other trainings coming up, being scheduled. You can refer to our trainings page as well if you're curious to check out more information, which is wicps.org/trainings. And I'll just go back to the chat here. So yeah, I see this question from Maria. Any updates on the peer training in Spanish for Latinx community? So yes, I'll get to that in just a moment, but what I will say for now is that right now we're doing a revision to the revision of the peer specialist curriculum. Now that the revised certified peer specialist curriculum has been out there and implemented for about a year, we wanted to review that, check in with trainers and participants and see how that has gone, and do some final tweaks and revisions before that curriculum will be translated into Spanish and Hmong languages to start with. And so right now we're in that side of that process. And then once that is put out with the translations, there will be trainings to follow. So with the exam, we often update in terms of the exam, just who is passing, what the overall pass rates are. The December 1st CPS exam, you can see it had a pass rate of 86%, 43 out of 50 passed. In December, there was not a parent peer specialist training there, and so just 3 people took that exam. Also, they were all retaking the exam. None of them happened to pass that time. However, the exam prior to that had an 82.35% pass rate.
Wow.
Based on the raw data for the February 23rd exam, we're seeing an 86% pass rate there. And then the CPS exam on February 2nd, we had 33 out of 37 pass with an 89.2% pass rate. So with all that, I'll just say that we actively, as I kind of alluded to before, do data analysis. We review each item meaning question on the exam, to see how people are doing question by question. And based on that, we look at the questions just to see if there's any glaring potential issues with a question where like everyone is getting that wrong. Over time, we review that and we sometimes have revisions for the exam. And through this data assurance process, we have seen positive changes to the exam, also relating to an increase in that passing percentage for how many taking the exam end up passing. So with recertification, in January of this year, we had 15 parent peer specialists due for recertification. 7 of them submitted documentation and payment and recertified. That's an overall recertification rate of 46.7% there. It's not too different than some past certifications, although usually we see a little bit higher of a rate for peer specialist recertification. But given just kind of the different considerations of job opportunities for parent peer specialists throughout the state, as well as that it is still basically a pilot program, that's actually numbers that I was surprised that it was that high. Also a note here that UW-Milwaukee School of Continuing Education that supports with the exams and the recertification, they have made a change as of this contract year to also allow for just a completely online process for the first time. You can now apply for an exam or recertification only online if you want, also submitting your payment online via card. So that is another kind of access improvement that we've had this year. So, and then I think I'm going to go through some of the rest of this and then go back to the chat. But with ongoing projects, the curriculum feedback I mentioned, we checked in with trainers in December for the peer specialist curriculum, just to get kind of a year's reflection of feedback there. Also reviewed all the feedback we had from participant exit surveys from trainings, as well as just other consultants. And we are currently in a process of doing another set of revision to do a better cultural weaving throughout the curriculum, to also get that in a place where it will translate well into other languages. And it will also have some community and cultural relevance as well in a better way when that happens. One other project that has been happening recently is we've been having some bridge building conversations in regards to certified peer specialists and recovery coaches. So those are different roles, of course. And recently we had a gathering between myself and Jesse Heffernan of Helios Recovery Services, where we talked about kind of the differences between our roles, also where there's common ground, and just kind of where we can learn from each other in our communities, while also realizing that there are plenty of people who are in both roles, both recovery coaches and certified peer specialists, and finding out how to move together in peer support spaces and just as a larger community in Wisconsin. One thing we also offer is communities of practice for peer specialists and parent peer specialists. We also have a supervisor specific community of practice. And sorry, these were the updates for last month. We are also updating this this month. This month, our supervisors community of practice is just going to be a general gathering and networking discussion. And then on the 17th of this month, we'll be actually, I'm going to facilitate along with Say Okaranta, who's a certified peer specialist trainer, how to build more inclusive spaces for for transgender and non-binary folks in peer support. So with our communities of practice, most of the time for those, the sole exception being the gathering and networking topics for supervisors community of practice, we also offer continuing education hours for people. So yeah, other updates, we've updated some data and feedback forms this year. The parent peer specialist curriculum is going to be revised as well. And Lynn Midday Big Boy of Department of Health Services is going to be leading that project. Lynn Midday Big Boy is also a certified peer specialist and certified parent peer specialist trainer. Other things are expanding employer technical assistance. That's part of Marguerite's new role. And also we've made some changes to our jobs page. We are making sure that any jobs listed on the wicps.org website include a transparently listed wage or pay rate or range, demonstrate basic adherence to the Americans with Disabilities Act, and we do review those just to kind of do a check on, like, is this aligning with the role? So there we just have some other resources, but that's what I have there. And let's see, I'll go to the chat, and then I'm also happy to answer questions anyone may have. So I see, do you review for biases? There are questions that are answered differently based on your linguistic ethnic experience. And yes, there is a statistical measurement that UW-Milwaukee School of Continuing Education has for questions around that. The questions also went through a process at the very beginning of everything too, that also measured along the lens of cultural bias or linguistic bias. And a similar process will happen for any updates to the exam after the final revisions to the curriculum as well. And then, yeah, also accessibility for, yeah, intellectual and developmental disabilities. That I honestly don't know if I could speak to with a full informedness on, historically speaking. I think there's a lot of room for improvement in general when it comes to accessibility of the exam, and that's part of our work plan this year as well. As well as also like linguistic appropriate exams also when the curriculum is translated. Part of that other process too is making sure that the exam follows suit. And that all pieces of this initiative support a linguistic appropriate and accessible track, basically. And then Hope asks, are there support protocols in place for peer specialists to offer ongoing support for them? What is the turnover rate or maintaining their employment? So yeah, Hope, in terms of what the Wisconsin Peer Specialist Employment Initiative offers, we do not offer ongoing like peer support for peer specialists. However, we do have our communities of practice, and those communities of practice really do function as communities of practice and not just like a webinar series or something like that. And so those are community building opportunities, networking opportunities, as well as continuing education resources for folks. And so with that, when we gather and discuss a topic area, oftentimes there's like free discussion and people connecting. I know people have networked and connected off of those spaces through first finding each other in that space. But otherwise, I think there are some regional support spaces like the Dane County Peer Specialist Network, or even more just like city specific or regional places. But that is something that could definitely be developed more, is like just like more local specific resources of support for people in the roles. And then turnover rate or maintaining employment. That is actually something we don't really have meaningful data on, which is something that we are hoping to build into our recertification forms more concretely. In August of this year, for the first time, we added an employment question to the recertification form to just see, are you currently employed in a peer specialist or parent peer specialist role and or a supervisory or leadership position to those in those roles? And that question is there to see, are people recertifying considered in this workforce, right? But what we don't see in that currently is like turnover rates. You know, that just tracks if they're employed. We don't hear about specific organizations. What we do know, just based on the conversations in our communities of practice and some of the general qualitative feedback we've gotten in other forums and such, is that there is high turnover, as there is in all the human services. I think there are specific things that relate to that for people in peer support roles. It often gets framed in terms of burnout or compassion fatigue. However, I think we also need to explore moral injury and the impact of potential moral injury for the peer specialist workforce. And just really quickly, moral injury is this thing that can happen that looks a lot like burnout, looks a lot like compassion fatigue, but its source is different, right? Its source is acknowledging that when there are major ethical conflicts in place, or when there is a values divide, there is moral injury that could happen. And a lot of peer specialists with a specific set of values and principles and like guiding ethical frameworks that are different from those in clinical roles are also working in settings that are primarily clinical. And so when that happens, our policies and procedures may conflict with peer specialist practices and values as well. And so I think a lot of people are dealing with that. And, but also a huge part of this conversation is pay equity. Peer specialists and parent peer specialists are not paid a living wage in many places, much less a family supporting wage. And that's a huge issue that impacts retention across the board. So yeah, I got a 5-minute warning a few minutes ago, but I also see a question about training people specifically with lived experience of hoarding. And I would say, yeah, but not specifically with that lived experience. It would just be, you know, I'm sure there are people who are peer specialists throughout the state where that's part of their lived experience of mental health and or substance use challenges. I know some, but yeah, it's just what defines a peer specialist, at least for this sense in Wisconsin, is just that large umbrella category. But we don't have like eating disorders certified peer specialists or, you know, bipolar disorder or hoarding. There's also a challenge when like specific lived experiences are kind of defined only in a medical model framework, right? Or a diagnosis-based system. So yeah, and then percentage of people of color in your overall training. That is also information we don't have complete data on. Just last year, we started adding optional demographic questions to our training applications. We also now have that in our recertification data, but it's incomplete. So we don't have it for the full workforce or trainings throughout the history of the initiative. So hopefully over the next couple of years, as these demographics questions are included in the training applications, in the exam registration forms, and the recertification forms. And it's really those exam registration forms and the recertification forms where like database is centered. That will take time for that to catch up as people go through their cycles of recertification for us to have more complete data. But part of us getting demographics questions in there was also contingent on them being optional. And so it will never be complete because they're optional questions.
Thank you so. Oh, sorry. Go ahead, Mary.
Brittyn, I'd like to thank you so much for coming and being with us today. You've provided us a wealth of information that we've not had. We've simply not had it. People are always asking questions. You are a walking encyclopedia. So thank you for taking the time and greatly appreciate it. And if we can have you come back again, that would be wonderful.
Of course, I'd love to. Thank you very much for having me. Unfortunately, I do need to run to another meeting.
Yeah, that's
but
fine.
Thank you all.
We've got to get moving on too. Thank you very much.
I will drop my email in the chat here.
Okay, that's great.
As well as my work cell. So
Okay,
if you
if anybody's
have any
got
questions, feel free to contact.
Okay.
Right.
Thank you.
Bye-bye.
Bye. Okay, April 5th is an election day and a historic election for the city of Milwaukee, where a new mayor will be elected. We are pleased to welcome Mr. Donovan, and we have provided each candidate with some specific questions in advance, which are posted with our meeting materials, and the link is in the chat. The general ask was to offer your visions for the issues and are a priority for people who live with mental illness or substance use disorders. And I'd like to welcome Mr. Donovan.
Well, thank you so much, folks. I appreciate being here with you. Can you hear me?
Yes, sir. You've got the floor.
Beautiful. Beautiful. Well, did you have a specific question, or would you like me to just begin with my concerns regarding mental illness, or?
if you just would like to, where did Barbara go? Well, you had gotten the list of questions and
Yes, yeah.
so, yeah, you can just proceed on and
Oh,
then,
okay. You want me to read those questions? And, you know, I
well,
jotted down my answers to them if you'd like.
Well,
Bob,
why don't we
one
kind of,
second, Mr. Donovan, hold on, Barbara Beckford's here, she'll talk to you.
Yeah,
okay,
great.
great. Thanks, Mary. Yeah, thanks so much for being with us, Mr. Donovan. So just to kick things off, we asked each of the candidates if they would begin by sharing their vision for our community, for people who live with a mental illness or substance use disorder. And as part of that, to talk about crisis response, both for youth and adults, to talk about how you'll increase access to treatment and other supports for both mental health and substance use disorders, how you'll reduce the number of people in the criminal justice system who have a mental health diagnosis, and as part of that, increase access to safe, affordable housing. So if you wanted to share those general comments, and then we could ask some of those specific questions as a follow-up. Thank you.
Sure, that's fine. And again, folks, I appreciate the opportunity to be with you. As I think most of you may be aware, I served the citizens of Milwaukee for 20 years as an alderman, representing the 8th district on Milwaukee's near south side. Over that period of time, I believe I developed a reputation of standing up and fighting for my constituents' best interests, of tackling the myriad of problems that I believe our city was faced with, and developed a reputation, quite frankly, of getting things done. And I think that that would, all of those qualities I still have, along with the energy and commitment and determination to move our city forward. So I would bring those qualities to the mayor's office. Obviously, if I were to address some of the many challenges our city is faced with, I'm sure most of you would agree that the issues of public safety, of reckless driving, the record-breaking homicides, the leading the nation in stolen vehicles, all of these things that are a real challenge to the growing number of Milwaukee residents. Also, in addition, the city of Milwaukee, most people, most citizens may not be aware, we are literally teetering on the verge of insolvency. So we have some significant fiscal challenges that our city is faced with. I believe that none of those challenges would be adequately addressed without developing a partnership with the state of Wisconsin. And I believe I have the ability to put together that partnership, and working with many of the legislators over the years on a variety of issues. I believe I've developed good working relationships with many of them. Certainly I can go into these specific questions, but I will also say this. I don't pretend to be a mental health expert, but as a leader, I recognize that when you're faced with a challenge, a couple things need to occur. You need to first admit that that challenge exists, and you need to get the right people around the table to fashion a solution to that particular problem. So as mayor, I would certainly want to bring, I can only imagine, most of you around that table to address to advise me and to address some of the specific issues that we're dealing with. One thing that I have indicated previously is that I would want to create, as mayor, a medical advisory committee made up of professionals in the medical field, including mental health professionals, to address the many health challenges that our city is faced with, and work in conjunction with the health department. So Having said that, I'd be more than happy to address those questions.
Great, thank you so much. So the first question that we hoped you would address, Mr. Donovan, relates to the intersection between law enforcement and mental illness. So law enforcement are often the first responders when a person is having a mental health crisis. And that can be difficult both for law enforcement and for the person who is in crisis. So we wondered what your plan is to address crisis response and offer alternative approaches, and also how you'll work with Milwaukee Police Department to reduce the number of youth and adults with mental illness who are in the criminal justice system, and instead connect more people with services and support instead of jail.
Sure. Certainly, I recognize that the challenges that the city is faced with regarding mental health issues, and the fact that the police, just as you say, are often the first and in some instances the only response to some of these individuals. To me, it's imperative, and I know there have been improvements in training of officers regarding mental illness. I believe there needs to be more. Second of all, I wholeheartedly support mental health professionals responding along with the police to these particular instances where it may involve an individual facing some mental health challenges. And the reason I say both together, and it's imperative too that the mental health professionals be available 24/7. And that takes a lot of money. That takes a lot of resources, but I do feel it would be a goal and objective that needs to be worked towards. And the reason why I say both responding is because the reality is, in any law enforcement professional will tell you that it's not uncommon to have a lower priority call that can escalate very, very quickly and become a high priority, very dangerous situation to respond to. And I certainly wouldn't want to put anybody in the position where they may not be trained to deal effectively with some kind of physical confrontation, or if there's a weapon involved, and so on and so forth. So that would be the approach that I would certainly want to take, working in conjunction with the police chief and the Fire and Police Commission, and training of those officers.
Thanks for that response. Now we'd like to focus a little bit on children and youth. Again, there are a lot of challenges across our state, including in Milwaukee, for children with emotional disturbances to get access to mental health care. And often it only happens when there's a crisis, and kids may end up in the child welfare system or the juvenile justice system. And we would like to see more kids getting help early. So we wondered, as mayor, what would be your plan to address the clinical and emotional needs for our youth, and to ensure that there's a focus on prevention, early intervention, and treatment access?
Yeah, I know the state of Wisconsin is working with the Milwaukee County in providing a juvenile facility here in the city of Milwaukee, hopefully within the city. Having said that, I would like to see this effort that Alderman Murphy has been advancing on the Milwaukee Common Council, the Juvenile Reception Center, that allows for individuals, not only judges or the court, the juvenile justice system, but also teachers and parents and pastors and so on, that can recommend children go into this particular facility. And it has all of the resources at one stop that can direct this child and can do the mental illness testing, can do the physical testings and so on, and evaluate that child and get that child the necessary resources that's available. It's been, to my understanding, very successful in Portland. And I've always been a believer, you don't have to reinvent the wheel. Oftentimes, many good programs exist in other communities that we can duplicate here in Milwaukee. So that would certainly be one of the major approaches that I would like to take.
Yeah, thanks for sharing that example from Portland with the Juvenile Reception Center. There's a follow-up question in the chat asking what your feeling is about getting programs in the schools to help with mental health needs and how you would address that.
Well, I'm all for including and working with all of our schools, not just MPS, but all of our charter and private schools. This is an issue that certainly needs to be addressed, and we're seeing, I think it's just a terrible situation that we're seeing, perhaps, I'm sure most of it due to COVID, but we're seeing such a horrendous impact on our young people for a variety of reasons over the last couple of years. So yes, I certainly feel that our schools need to be on top of this situation and have the resources necessary. A lot of this, again, will certainly, it takes money. And a lot of this will depend much on partnering with the state and the county, and I believe that, and our federal partners as well, and perhaps tapping into grants and so on. So if it's a priority for the mayor, it will be followed through by the various city departments and working in partnership and perhaps even with the private sector, certainly.
Okay, thank you. We're seeing a record number of drug overdose deaths in our community. And again, this is a challenge not only in Milwaukee, but across the state. So we wanted to know what your plan is to address that challenge, and specifically what you would do to improve access to Narcan to make it more widely available, as that can help save lives.
Yeah. I sort of look at that as almost a miracle drug and what it's been able to do in reviving people. And I know the Milwaukee Fire Department has been working very hard on expanding access to Narcan, and they have and are pursuing a grant. I will say this, I believe very soon there may be some good news coming forward on that front. That's about all I could say at this point, but so I certainly would want to work with them in any way I can to help make that a reality.
Well, thank you. Well, looking forward to hearing that good news that you mentioned. So we'll stay tuned for that. So one of the areas that's really important to recovery for people living with a mental illness or addiction is having access to safe, affordable, accessible housing, including emergency housing for people who may have a crisis and don't have anywhere to go. So what is your vision to increase access to safe, stable, affordable housing in our community, and to work with the mental health community and landlords and other partners to move that forward?
Sure. One of the things that I have seen over the years is within the homeless population is so many that are either suffering through mental illness or addicted to substance abuse or alcohol. And one of the things that I would like to work on, and first of all, I would urge everyone to go to my website, bobdonovanformayor.com. I sort of lay out this strategy of building tiny homes and working with the homeless, putting people to work in the production of those homes, and allowing the individuals with mental illness, substance abuse to have these homes available, and then have, again, the resources right there nearby on that same campus, if you will, to help these individuals address their particular challenges. And so that's sort of laid out to some extent on the website. And I would urge people to go there and they can look a little more at length.
All right, well, thank you so much. If there are any questions that folks have in the chat, please feel free to add those. We have another minute left, and I'll just turn it back over to our Mental Health Task Force co-chairs, Christine Apple and Mary Neubauer.
Thank you so much for coming to our task force meeting and telling us your vision for assisting people with mental health struggles and substance abuse issues, and our youth and the people who need safe and affordable housing. Please know that the entire task force is here to help you help the people whom we all serve. And so we're offering our services. I know Mary Neubauer is on one of the committees for the city, but other people are very interested in also helping out with this initiative. And thank you for remembering our issues as well as you
Well,
proceed
thank
forward.
you. Thank you very much. Appreciate it. Have a good evening.
Thank you. Okay. All right, I'm going to move right on to our next speaker. It's important that people who receive mental health services understand their rights and, when necessary, unfortunately, know how to file a complaint. We want to welcome attorney Melanie Cairns of Disability Rights Wisconsin, who will discuss client/patient rights and the process of filing a complaint. And I didn't check, but hopefully attorney is here.
I'm here.
Okay.
Thanks, Christine. Can you hear me?
I can.
Okay, so as Christine said, my name is Melanie Cairns. I am a supervising attorney at Disability Rights Wisconsin. And I still find this process of talking on large Zoom meetings to be awkward and difficult at times, and I get nervous. So when I get nervous, I sometimes start talking really fast, and I fall into the bad practice of using acronyms. So I'm going to try to slow down and not use acronyms or explain which acronyms I'm using. And so if there are any troubles following, and I also would like to make this, if possible, it's hard with a big group, but if possible, more of a conversation. So if people have questions they'd like to put in the chat, I will do my best to answer them. I did sort of prepare an order in which to present things, just because if I don't do that, then I end up not having enough to say. But I am absolutely open to interruptions, as long as you all understand that if you give me a complicated hypothetical and put me on the spot, sometimes my only answer is, well, that's a good question, and please give me your email address and I'll get back to you when I can. And I also want to say, wow, I never would have thought that I would have been on a meeting agenda with the two mayoral candidates. That's pretty amazing. So thank you again for inviting me. Okay, so our
Melanie, maybe you want to put your hat in the ring as the candidate. Give us your vision for mental health services.
Thanks, Barbara. That was really helpful.
I think you'd be great.
Thanks for that vote of confidence. Okay, so I did not prepare a bunch of background overview of Disability Rights Wisconsin and everything that we do. I can provide that too if you'd like, but I'm fairly certain that this group has at least a somewhat familiarity with Disability Rights Wisconsin, what our role is in the state and what we do. So I was going to just jump right into the focus that I've been asked to talk about today, which is a topic just near and dear to my heart, which is patient rights. And also introduce you and let you know that we recently published this tool, which is we're calling it a do-it-yourself guide or a self-help guide, a self-advocacy tool to help individuals draft their own client rights grievance, or to help for service providers or partners or family members to assist individuals with that. Now, the packet is not as, I don't know, I wish it could be as simple, but unfortunately the grievance process is not a simple process. So if you all have any tips about how to make our packet simpler, we tried really, really hard, and I'm certainly open to that, but it is a difficult process, so it's difficult to explain in simple language. Okay, so and I'm just going to open the chat in case I'm seeing anything. Oh, sure. Thanks, Barbara. So actually, I'm going to leave that till the end. You say if you have time, so I will leave that to the end. All right, so what are we talking about today? We are talking about patient rights, which are also called client rights. The terms are used interchangeably. And where do you find the basic information about patient rights or client rights and what they are? You find them in the Wisconsin statutes, section 5161, so 51.61. And you also find a more descriptive detail in chapter 94 of the Wisconsin Administrative Code, section DHS, so Department of Health Services. So DHS 94 of the Wisconsin Administrative Code. So that's why a term that you also hear, and this is just how I think probably all industries are, but there are often many, many names for what's essentially the exact same thing. So you'll hear the term chapter 94 rights or chapter 94 grievance, also used interchangeably with patient rights grievance or client rights grievance. So if I kind of bounce back and forth, I will try not to, but if I bounce back and forth, that's sort of the basics. So to write a bit of background, chapter 51 of the Wisconsin statutes is very, very long and detailed and covers many different areas. I'm going to tell you its full title just because I was pretty amazed when I pulled it up today. It's the State Alcohol, Drug Abuse, Developmental Disabilities, and Mental Health Act. And if you print it out, it is 74 pages long. So it has, just to summarize, it has, it describes like the State Council on Mental Health, the Council on Developmental Disabilities, the mental health facility certification, developmental disability services, the emergency detention process, the mental health commitment process, how the process works differently in Milwaukee than in other counties. In addiction treatment is what it's called. It's not called substance use treatment in the regular in the statute. It's still called addiction treatment programs, community support program, and many, many other sections. So we're today just talking about one tiny section, 5161, which is called patient rights. And in that section, so subsection 5 of 5161 states that the department, here meaning the Department of Health Services, will create, sorry, change my page here, make sure I get it right, will establish procedures to assure that patient rights are protected and enforced by the Department of Health Services, by service providers, by county departments, and will also establish rules and standards for the grievance procedure for any of these services. So while the list of rights and the fact that all providers must have a grievance process is spelled out in the statute, it's further expanded in section 94 of the administrative code. So that's kind of how those two work together. So why do I say that patient rights or client rights is near and dear to my heart? I just want to say that I truly believe that a genuine person-led decision-making process requires that the individuals who are receiving services are recognized as experts on their own lives, and that decisions about services and supports are based on their unique needs, on their goals, and on their strengths with a focus toward how an individual can live their best life. And in a system that recognizes those things, professionals actively seek understanding and welcome questions and focus on solutions. And you can't have all of those things unless you have a accessible, well-run, understandable grievance process. Because even when professionals do everything perfectly, there are still going to be some people who are dissatisfied for a variety of reasons. So, kind of lost my train of thought there, but that is why a good, easily understandable, easy to access grievance process is extremely important. Often it is the only option available to service providers, to family members, to advocates to say, I mean, here at Disability Rights Wisconsin, I like to say we're in the complaint department. People don't generally call up Disability Rights Wisconsin and say, I just want to tell you, the agency I'm working with is providing the best service I've ever gotten. And my therapist is great. And my case manager is fantastic. And I just want to tell you about it. We don't get that call very often. We get the call of like the problems that people are having and the places where they're dissatisfied. And often the only place we can point to is the grievance procedure. So that's what we offer. And prior to going to law school, I did work in direct services. I worked in both day treatment and residential services. I would say that, is it uncomfortable when the clients or the individuals we serve have a complaint about the work that we do or the way that we're handling their situation? It is uncomfortable, but I would say that oftentimes, or at least sometimes, once you say, okay, here's what you do, you file this grievance, and then so people can't focus on moving forward until they're able to have an outlet to complain about where their dissatisfaction lies. So in that way, it's a really good tool as well. Okay, so whose rights are protected? Any individual who's receiving treatment for mental illness, developmental disability, substance or alcohol use or dependency. It's regardless of certification or licensing status. And that's not something I'm talking about today. Sometimes it gets mixed up. I want to file a complaint about licensing, or I want to file a complaint about certification, so oftentimes people have the right to file both types of complaints. We're not talking about licensing or regulatory or anything today. We're talking about Chapter 94 grievance, rights under Chapter 94, and Wisconsin Statute Section 5161 that apply to any individual receiving any treatment or service for mental illness, developmental disability, substance or alcohol use or dependency. So starting with rights about grievances, just kind of summarizing those, because that's sort of the first thing we need to tackle. All community and inpatient mental health, intellectual disability, substance use agencies must have a written patient rights grievance procedure. And they should also identify a trained client rights specialist. Don't have to use the term client rights specialist. I think it's helpful because that's the term used in the law. But some agencies I've come across client rights facilitator. I'm sorry. So here's where I get nervous and have to slow down and take a break for a minute. Client rights facilitator, patient rights, different terminology, but there needs to be someone who's trained and whose job it is to receive grievances, to make a decision on grievances, and who wasn't part of the subject matter about which the person is complaining. All agencies should have both an informal and a formal process for resolving grievances, a process to notify patients or clients before or at the time that they began receiving services from the agency. And that notification should be written as well as explanatory in a way that allows people to make sure that they understand the process and know how to access it. the process should have a time limit for responding to grievances and time limits for deciding about appeals if the agency is one that would accept appeals. A process by which individuals can know how to appeal to the next level. And also protections against any application of sanctions or retaliation or anything like that, any sort of negative response as a result of filing a grievance, asking about their rights, asking about how to complain. And every employee of the agency should know what the client rights grievance process is and how to help people access it. People should also be regularly informed, re-informed about their rights and provided a copy of the grievance procedure. Did I miss any there? Oh, and finally, it's clear in 5161 that an individual could, instead of, after, or before accessing their right to file a grievance, they could also, or instead, like I said, file an action in court. So the two are not related. So they could file an action in court saying their rights were violated. To be honest, I have never seen that done successfully. So I don't want to focus too much there, but it's possible that somebody could file in state court and a violation of their client or patient rights. So let's see. Okay. Thanks, Denise. I'm just reading through the comment. Yes, thank you. And there are some provider agencies, I think, that have videos as well. But yes, not only giving a written, I mean, honestly, in our daily lives, we are frequently, we go to a website where we respond to an email, we go into an agency, a new office, any sort of relationship, and we're given this, like, here's a piece of paper, sign it. That's not sufficient. You need to go through with people, the list of rights. What does it mean? What are circumstances in which you might be able to file a grievance? So thank you for making that point. So what type of rights are protected? There are many, many, many rights, and they're listed in both the statute and the regulation. I'm not going to list all of them. You can find most of them on pages 2 and 3 of the self-help packet. The most common ones we hear about, or the most common ones I hear about, are patients feeling like they weren't treated with dignity or respect, feeling like they did not receive prompt and adequate treatment, or that the treatment was not in the least restrictive setting, that they were not allowed to participate in their planning or their treatment or advised about other alternatives. That this one can get awkward the way you say it, because it's the right to be free from abuse. So people don't usually say my right to be free from abuse was violated. They say I was abused. So abuse, including sexual abuse, including emotional abuse, physical, verbal abuse. And that includes freedom from inappropriate restraint or seclusion, or used restraint or seclusion used as a means of force, control, or punishment. Staff need to make fair and reasonable decisions about treatment and care, and individuals should not be taped, photographed, filmed without their consent. And people have the right to make and receive telephone calls, see visitors, spend money how they choose. Unless, of course, all of these, some of you know you work with people who are under court order, usually mental health commitment, maybe a different type of court order, guardianship order, or a protective placement order. At that point, there is a restriction on people's rights, but without a court order, people are entitled to this whole list of rights. Oh, and there is a process allowable under 51 to do a rights limitation. I won't get into great detail. It almost only comes into play, I would say, in the in the hospital setting, in a facility setting, not in a community setting. I could be wrong, but the process to do a rights limitation should involve notification to the individual of what the limitation is and the right to dispute that. I mean, it doesn't have to be a formal court process, but the right to sit down with the providers and say, why are my rights being limited? And to dispute the reasons for doing that. And then, review every so often of whether the limitation is still needed for some sort of valid treatment or safety reason, rather than for convenience of staff, for example. So what are the steps in the grievance process? The first step is informal, and the informal process is entirely optional. So basically that means talking to individual case manager or other staff person or supervisor or the client rights specialist and just saying, I was dissatisfied about this thing. I think it was a violation of my rights. I don't have a lot to say about the informal process. Sometimes it works. It's great when it does. Often it doesn't. So then the true first step is to file a formal grievance, and it should be filed with the client rights specialist or forwarded to the client rights specialist. It should be in writing if possible. At least we recommend that to individuals. However, if it's filed in another format, including verbally over the phone or in a conversation, the client rights specialist should assist the person to put that into writing. So the client rights specialist should issue or should investigate the grievance and should issue a report with findings. The findings should say it's either substantiated or unsubstantiated. I see a lot of like filing a grievance and then the response is like, well, we disagree, instead of like, it should be, we investigated this. This is who we talked to, or this is who I talked to, and made a determination that your rights were violated or were not violated. And this is what we think we should do about it. So there should be a written decision. It should be issued within 30 days. And if either the person, the individual who filed the grievance, or the program manager, like the client rights specialist program manager, the regulation just uses the term program manager, disagrees with that initial decision, then there should be a second decision. So like level 1 is a bifurcated process. It's like 1A, I guess, is the client rights specialist decision, and then 1B is the program manager decision. So that can be pretty confusing. And then level 2, so the first level of appeal is county level review. So when the service is authorized by the county, then that first level of appeal is to the county. So if the individual is enrolled in comprehensive community services, but the grievance is against their residential provider, but their comprehensive community services. So they first file the grievance with the residential provider. If they're dissatisfied, the first appeal should be to the county. And I know that Milwaukee County, I don't know. I'm sure that I could find who the Milwaukee County Client Rights Specialist for the different types of programs that clients contact us about. But I wouldn't say it's always completely clear cut. The regulation says that it should be sent to the administrator. I saw Shakita was on here. I'm guessing that Shakita doesn't necessarily want people to forward all the grievance appeals directly to her. But that is what the regulation says. But if the service is not authorized by the county is not involved, such as the person's in family care or IRIS, or they get this through their Medicaid card service, then you skip the county level review and you go straight to so it goes with the agency. And then if you're dissatisfied with that decision, you go to the state grievance examiner. It is an actual individual person. Her name is Emily Mickelson. She works in the Department of Health Services Client Rights Office, which is situated in DCTS, Division of Care and Treatment Services, right? So, in my materials I did, and also in the self-help packet, there is a link to the Client Rights Office website, which has her contact information. And she does a lot of these types of outreach trainings too. So if you haven't had her or her team come and talk about client rights, that might be a useful tool for this group. Okay, so if the person then is dissatisfied with the state grievance examiner decision, then the next step, the final level of review, is final state review, which is done by the administrator of DCTS. It's just that decision. So I won't go into great detail about timelines. Each level has its own timelines, but they're fairly consistent. So generally, you should file the grievance within 45 days of learning about the rights violation. However, time can be extended for good cause, and the definition of good cause is pretty broad. It's like if substantial injustice would result if you didn't investigate this, which, you know, you can usually come up with a reason for that. Or if it would improve services for this individual or other individuals. So you can usually come up with a reason to file late. And that should be, I think, waived generously. The 45-day deadline should be waived generously. And a decision to not allow the grievance to move forward because it was late filed and good cause is not going to be granted is itself appealable to the state grievance examiner. So that's something to keep in mind as well. I am almost out of time. So I'm just going to summarize what you'll find in the self-help packet, which is a list of rights, a summary about the procedure and steps, and more detail about the timelines. So I didn't go into that. Tips to drafting a grievance, and those are meant to be written in a pretty basic way. We don't need magic language, and it doesn't need to be super formal. You know, I think one of the examples in the packet, I can't remember which one we ended up using, but it's like, I live at a group home and staff wouldn't let me use my cell phone unless staff were listening. I think that violated my right. Or I don't think they can do that. I mean, it just doesn't have to be, it's better if it's written, and it's better if it says, I think my rights were violated, so that the agency knows what to do with it. See what else is in the packet. Problem solving for commonly encountered bumps in the road, and templates that we think and hope will be useful to drafting a grievance and appeal, and also track correspondence or communication about the grievance so you don't miss timelines. I already mentioned that where you can find more information is at the Wisconsin Department of Health Services Client Rights Office website. They have like pamphlets for providers, model grievance procedure, a decision digest, which can be pretty helpful. So it breaks down like by issue area, what are other level 3 and 4 decisions, like where did they, so that can be pretty helpful to you know, to wording the grievance that you're filing to see how other decisions were issued. An online training for client rights specialists, and a link to all the statutes and administrative code sections. And I think that's all I have. See, centralized reporting and tracking of number of grievances filed each year. I do not believe so. The Client Rights Office might track grievances that are appealed to level 3 or level 4, but I'm not aware of that, and certainly not at the agency level. Let's see.
There just aren't really any measurements to ensure that people are being informed of their rights and have the opportunity to exercise them, like with the complaint process, I guess is what I was getting at in my question. You know, their law says that you're supposed to do this, but does it happen?
Mm-hmm. And I think we tried to address that in the bumps in the road, because that's what I hear the most often is, well, I tried to file a complaint, but they said that they don't have that, or, you know, they didn't know who I was supposed to talk to, or they just wanted to talk it out, or whatever. Like there's a lot of, or why would you want to do that? That's too much trouble, or, you know, whatever, or staff apologized to you, like we consider that done, or, you know, like that kind of thing. And it's not, I don't know that it's intentional. I just don't think that there has been as much of an intentional focus on letting individuals know the entire list of their rights, and who to go to and what to do specifically if they believe one of those rights was violated.
Great. Thank you very much, Melanie. Appreciate your presentation on patient rights, and I'm gonna get that guide and start working on it. I have a few grievances to file. Oh, excuse me, Christine. You have your hand up.
Oh, no, I was clapping.
Oh, that's a clap. Sorry.
And we are working, Barbara will be happy to know that I'm working with Elise right now to get it easier to access the packet on our website.
Oh, great.
Mhm.
And maybe we'll have it in Spanish in the future too.
Absolutely.
Yeah, I have some funding I'd be happy to use to help with that. If that's a barrier, I think it's a great resource. So thank you so much for all your work on this.
Mhm.
Thank you very much, and we'll have you back again. You were a great presenter.
Yeah, I can't wait to come and do it, to talk more in person. I miss in person. So
Yeah, so do
maybe not too
we.
much longer.
Thank you very much.
Yep, thank you.
Okay, next I will just give a brief update on some mental health board items, and then Barbara will speak about some state legislative updates. Mental health board. I would like to share that the mental health emergency center that was supposed to open in May or June has now been delayed to the date we were given was September 6th of 2022. That is September, the 9th month of the year. And the delays have to do with hiring staff. Anticipated hires that they thought were going to go very smoothly have not happened, and they need an additional 3 months to hire and train. There is a national search going on for a medical director at this point in time. The mental health board was advised of this information at our board meeting last week, Thursday. And there was a statement put in on behalf of the mental health task force in the Wisconsin Health News last week. Mental health board, needless to say, was very unhappy with this information, and we're very concerned that more employees will be leaving psychiatric crisis services, which is going to leave fewer employees there and more, because half the staff that are now are temporary employees are agency staff, which means that the care is not consistent because it's not people that are county employees, and people are going to float out of there. I mean, there's a number of people that are staying on for their bonuses and things, but it's less consistent. So some real concerns for the mental health board. And I know Shirley can speak to that herself, and for her thoughts and ideas about that. So that was the biggest news that we got, was that the mental health emergency center, and for those of you that don't know, it's located on 12th and off of 12th and Lee 12th and Walnut, behind the COG Center. The other another piece of information, we had a vacancy on the board for the substance use position, and the county board supervisors did not act on filling that position, and they had been notified that there was a candidate and didn't do anything with it for 60 days. So the county executive appointed Kenneth Ginlick as the substance use provider on the mental health board, and he was appointed and filled that role. There are going to be some other vacancies on the board because people have met their time, and that will be happening in the next couple of months. So we'll be able to let you know what those positions are, and if anybody would like to serve on the mental health board, there will be some spots coming available, so get your pens ready to fill out applications. It's a great opportunity. It's an opportunity to share your expertise and your skills and have a amazing ability to volunteer your time. So that's pretty much what's happening with the mental health board.
Mary,
And-
I wondered if you might say a few words about the March 17th meeting about public
Yes, I
input.
was just headed there.
Comment.
On March 17th at 4:30 is a public comment meeting. And that is to talk about the, we're already getting into the budget season.
Yeah.
And Matt Format, the chief financial officer, will be giving an overview on the budget at that meeting, and individuals can comment on their thoughts about the budget. And oh, Barbara has the link for the budget. You're on mute. And in the agenda, thank you. So, and again, public comment is so important, and especially when we come to the budget. What the public talks about and what the public wants to see in the budget is what gets done in the budget. That's the thing, where the investments are. And the thing to remember now is the hospital isn't there. So what's the monies that are there go back into the community. So please come and be on Teams to talk to the mental health board at 4:30 on Thursday, the 17th, and share what you would like to be in the budget for 2023. And the mental health board budget gets approved in July, much earlier than the county budget, because our budget has to be calculated into the full county budget. So that is what I have to share.
Thanks a
Really?
lot, Mary.
Yep.
This is Barbara Beckert from DRW. I'll just give a few real quick legislative updates and also voting updates. So the legislative session is winding down. The assembly actually says they won't be meeting any longer, but it's possible they could be back in session. The Senate was in session today. And unfortunately, there have been a lot of bills that we have concerns about, and some good ones that didn't make it across the finish line. So the Mental Health Task Force had supported the changes to the Treatment and Diversion Program, TAD, which would allow it to be used to serve people who have only a mental health diagnosis. Currently, it's specific to people who have a substance use disorder, and this would have allowed funding to be used to support mental health treatment courts and other diversion supports and services. So it's disappointing that that did not come up on the floor in the assembly, and maybe we'll get lucky and that will still happen, but honestly, it's not looking very good. Unfortunately, what has come up are a lot of bills that would make it more difficult, that would impede access to Medicaid, to food share, and to unemployment insurance benefits. And I won't go over all the bills because we're short on time, but they were approved by both houses of the legislature and will be going to Governor Evers. And the Mental Health Task Force Steering Committee made the decision because these would be so harmful for many people who live with a mental illness to sign on to a letter asking Governor Evers to veto these bills. So those are moving forward. We'll share that letter with you as soon as it's available. It was developed by Kids Forward and John Peacock, who some of you may have known. So in addition to that, we've seen a number of bills move forward to restrict voting rights, and that's also been a very challenging area. So right now we have, as you heard earlier, an important election coming up in Wisconsin and in Milwaukee on April 5th. So we encourage all of you to do what you can to encourage the people you work with and clients and consumers to know what their voting rights are and to participate in this election. We have a lot of good resources that we hope that you will check out. And we also have at Disability Rights Wisconsin, we have a voter hotline, and we're available all year round to assist voters. So we hope that you will help with this outreach. So I'm going to put a few resources in the chat for you right now to consider. One is our voting postcards, and this is something that some of you have used in the past to get out to clients, and we hope that you'll consider doing it again. I'm just having a little trouble with the link here. So naturally, since we're short on time, my computer seems to have locked up. But in any case, we hope that you'll get these materials out. I'll send a follow-up email with all of the resources to folks. And one of the reasons it's especially important now is because there's a lot of confusion about voting right now. Absentee ballot drop boxes, some of you may have heard, are not allowed to be used in this election because of a case that's currently being litigated, and DRW is one of the parties in that case. We think absentee ballot drop boxes are really important, and we're also concerned that this lawsuit limits what's called absentee ballot return assistance. So that means if someone isn't easily able to mail their own ballot, that they could ask someone else, whether it's a friend or a family member or a case manager, care worker, to assist them with that. And right now, based on the ruling by the Waukesha County judge, that isn't being allowed. So I'm mentioning that because if you're a person with a disability and this impacts you, we would encourage you to contact your clerk and ask for accommodation, or give us a call at Disability Rights Wisconsin at our voter hotline, and we would be happy to help you with figuring out a way that you can cast a ballot. So that's the scoop. I know we're out of time, so I'll send those resources in a follow-up email, and I'll turn it back over to Mary and Christine to wind things up. Thank you.
So I'd like to thank everybody for joining us today, and we look forward to seeing you in April. Christine, do you know the date for our April meeting?
I was just trying to find that. I believe it's the 15th, but I could be wrong. I'm sorry, it's April 12th.
April 12th.
April 12th, and please also look out for the a look inside the criminal justice system emails too. So we want to see the 12th.
Okay, have a good day and see you April 12th. Thank you very much.
Have a good evening, everyone.
Bye all.
Bye-bye.
Bye.
Bye. Thank you, everybody.